I think by and large, most parents still trust their pediatricians. And I think studies have shown that what the pediatricians say matters to the parents. If you ask them who is the most valuable source of information for you for your child's health, it'll be 9 out of 10 times it will be your pediatrician.
When we go to legislation and we say we're representing over 2,000 pediatricians, suddenly they're really listening to us and they want to hear from us.
We are kind of all members of this one body and trying to, move our agenda forward, which is making sure that children are well taken care of and that they have a future and that we help secure that for them.
We have Doug Bell, who's worked on many legislative issues in Tallahassee, and he's gone and spoken to medical students, to residents, and to practicing pediatricians on how do you advocate for children. And there are lots of issues that come up in Tallahassee that we as a chapter are actively involved in, either preventing legislation from going through or promoting legislation to go through.
A lot of what I do is budget related, but there's also a great deal that I do which is statutory, trying to assist with bolstering up the child abuse prevention and child abuse treatment programs within the state, fighting against gun laws. The NRA has a very strong lobby here in Florida, and the pediatricians are very concerned about general safety, of course, but more specifically the safety of children as relates to guns as well. So there are a lot of other issues beyond just the budget that we work on.
We made laws to be able to protect children because the children cannot protect themselves. And that's why some of these issues, yes, we want to protect freedom, but we also want to protect the children because they really are counting on their caregiver. So that's another avenue.
Advocacy is part of pediatrics. If you are a pediatrician, you have to be an advocate. And it's for the simple reason. Kids don't speak for themselves. Kids don't vote. We have to be sure that they are well represented. And it's not just pediatricians' responsibility, it's everybody's responsibility.
The chapter is very, very involved in Tallahassee and has a wonderful relationship with many different legislators and who, feel that kids' issues are important, so that's good.
Really, in the end, it impacts overall children's health and their ability to see the pediatrician and have their needs met and make sure that they are healthy and they're doing well and they get their vaccines and that those vaccines are paid for and they don't have to worry about whether they will have a bill.
It's important for us to continue to looking at the future leaders of our profession to get them engaged and involved.
When students go into pediatrics, they don't go into it because they're going to become millionaires. They go into it because they love children.
Being part of the chapter just gives you that voice, to be with people who share the same vision, but also because we are growing in numbers, we can be a lot more influential.